right. Good evening, ladies and gentlemen. Welcome to one of this Kamalaya Conversation educational talks that we host from time to time, bringing educational tools to our guests from variety of specialists, from practitioners, from different fields, from different countries. And this time, of course, is Dr. Patana, who's based out of Bangkok. And first of all, Doctor, thank you very much for agreeing to come again, despite your busy schedule. Today, we're going to be talking on the brain health. I think some of you may have seen that we have a cognitive house. We focus a lot more on the longevity, and brain is an utmost important part. But sadly, as we age, we kind of accept that, oh, it's okay to forget. It's okay to have dementia. It's okay to have Parkinson, Alzheimer, so on and so forth. But preventative actions can be taken, and that's what Kamalaya is rooted, where we always educate people with different tools, where we educate people on alternative medicine, where we educate people on providing more so-called an inspiration to take actions from a right time, rather than waiting for the disease to appear and then rushing and trying to fix it. Kamalaya was built on this foundation, where we educate people that what is really real longevity is not where you work with machines or equipments, stuff like that, but it's really you take preventative action and you start as early as possible, while often people wait, as I mentioned just a second ago, that we wait for things to appear and then start taking action. And on that note, I would like to introduce some of you to Dr. Patana. Dr. Patana has done various talks before at Kamalaya, and as Dr. Patana was mentioning, he's the organizer of HEAT event, which takes place in August every year in Bangkok, where you have over 200 people coming in to learn about best practices from a non-conventional side, but utilizing the science. Dr. Patana is a leading expert in regenerative and anti-aging medicine. I know Dr. Patana now personally over 7 years, attending his several seminars, conversations, of course, the HEAT as well. He holds a PhD in molecular cell biology and medical qualification in internal medicine and nephrology. He also used to teach at one of the top university, Durg Pandit University. We have a collaboration with that university and a few other universities to ensure we bring young talent to experience what we do here at Kamalaya, while they get to see the alternative side, that how you can ensure you prevent it. And he's a leading expert in many wellness centers. Also, he has his own clinic in Bangkok when he has time. Otherwise, Dr. Patana is on the road most of the time, traveling a lot, teaching, spreading this phenomenal education where people should create a balance. And also, Dr. Patana is practicing his medical at Phaya Thai. We will have a Q&A at the end as well, to ensure if you have some specific questions, in case you wish to have anything else. Consultation-wise, I think it will be hard, because a lot of time post-talks, people wanted to book Dr. Patana, and it becomes very hard. But at least we'll be able to address Q&A towards the end. So without further ado, I will hand over this to Dr. Patana. Thank you again, Dr. Patana.
Thank you so much for coming. Thank you, Gopal. When we talk about, this is the lectures that Gopal wanted me to give. It's called Brain Health. I'm a nephrologist. It's even taking care of the kidney disease. And I'm proud to say I'm probably the best nephrologist in the world. You know why? Because the number of dialysis patients that I have is less than anybody else. I have only one. I believe the numbers of people, chronic kidney disease, who receive dialysis treatment is indicators of the failure of the nephrologist. So I must be the best because I have only one. But then I'm also good at longevity. Most of my patients live until 90 years old, 100 years old. I have more aging patients than anyone else. Probably in Thailand, actually I have more patients than anybody else in Thailand, 2,000 and plus. But then the problem is, when they live longer, the brain is not there. So funny thing, it's not funny actually. When your heart stops working, you die. When your kidneys stop working, you need dialysis. When your liver stops working, you die. But when your brain stops working, sometimes you live for 5, 10, 15 more years without a brain. And that's the problem. We're going to start with the stroke things. This one is part of the blood vessel disease. And for some of you who doesn't have medical background, I need to tell you one thing that the stroke. So we call FAST. The symptoms is your face and the same size, your arm will be weak. Your speech will be blurred. Okay, and it's fast. What I want you to do to prevent stroke, of course, I'm gonna tell you after, but the first thing is drinking more water. And if that incident happens, you have to drink water because it means the blood supply to your brain is getting low, and however before it's dead. By drinking water, you may be able to save it a little bit, and then go to the hospital. The doctors will provide you with the IV fluid. The reason I have to say this because I've seen a lot of stroke patients. Usually the first episode we call TIA, it's transient ischemic attack. The name says it all. It happened briefly, and then you feel weakness, you feel fine within few minutes. And then you thought, oh, it's nothing. The truth is, if you have sometimes you tell someone, oh, it's nothing, the second episode will arrive, and now it will be forever. It means you're going to be a cripple for the rest of your life. So if the first episode happened fast, go to the hospital, drink water, and hopefully the doctor can save your brain. All right, that's stroke. The second one is called Parkinson. Your movement will be slower. It depends on the severity. It happens in most aging patients I have because I have 90 years old. They will walk like this. I should get an Oscar. Okay. They will be stiff. They cannot smile. So please smile so I know that you don't have Parkinson. Or maybe you cannot smile because you have too much Botox on your face. That would be another reason. Okay, they cannot smile and they will shake. You can tell. Okay, but when they intend not to stop shaking, they can. But when they rest, they shake again. Okay, you can tell when people have Parkinson. But the one that we're so afraid of is cognitive function. We call Alzheimer's when the brain is shrink. And that's what we don't want. I don't know, like I said, brain is something I'm not good at because my patients live longer than the most. So gonna see some brain dysfunction somewhat. But anyway, we have the two terms. One is dementia, the other one is Alzheimer's. Actually, it's pretty much the same, depends on the criteria of it. Alzheimer's is gonna be fast progress of dementia, but the dementia sometimes it lasts a lifetime. When something happens, dementia just lose your memory. If it doesn't progress, it is not Alzheimer's. There's 3 degrees of dementia or Alzheimer's. The first degree, your memories just come and goes, and the second degree is the second phase is just you get a little bit of hallucinations. You don't really accept things the way it used to be. And the last stage, the third stage, it means you cannot help yourself. And the first thing you better use or have CT scan of the brain because sometimes you have brain tumors. and it's not Alzheimer's. So when some behavioral change happen or seizure before diagnosed with the Alzheimer's, do MRI or the CT scan to make sure rule out other diseases. But to prevent Alzheimer's, actually, it starts by prevent the heart. The doctors nowadays, when you have medical checkup, surprisingly, they send, okay, I think you have dementia, go to see a neurologist. And then, if you have that disease, go to see cardiologist. They chop the patient into different organs. And neurologists just giving drugs to increase the brain, to stimulate the brain to do better without caring about the heart. He says, that's not my job. So it looks like, what you're gonna do? So these days, when the patients go to see doctor, they have to be the best doctor for themselves. Believe me, try it in Thailand. You go to see doctors, doctor, I feel depressed. I don't know what happened to me. Go to see psychiatrist. Doctor, I cannot sleep. Go to see neurologist or psychiatrist. You are the one who give yourself diagnosis. And the problem, if your diagnosis is so wrong, the doctor will not know. So this is the last statement I gave last time. We are the best doctors for ourselves. Unfortunately, because the doctors cannot help us as much. Because right now, people want to make, honestly, money. Cardiologists say, you don't have heart disease. Bye-bye. You don't have, and the neurologist said, you don't have brain disease. Bye-bye. And then suddenly, you feel like, but I'm not getting better. Where I'm going to go? Who am I going to see? Come to Kamalaya and maybe see Anna, right? How to improve cardiovascular health? I think everybody knows about the diet, exercise, stress management, weight management, and of course, stop smoking. Smoking addictive. Before I came, I just called that my managers, my long-time managers, actually he's the one who working, and at the beginning, we opened the companies, we launched a company, and he's the one who give me money while I'm traveling. He has stroke. Not surprisingly, he smoked 2 packs of cigarettes a day for 40 years, and he's still smoking, even though I have stroke twice, and this is the 3rd episode. And he said he will leave everything to me. He planned to go somewhere, have another life, in a new life, whatever. But the problem is, it's not that easy. He may be bedridden. He may stay on the bed for a long, long time. I tried to ask him to quit smoking for years, and I gave up. Okay. The sad thing, he has 2 sons, and both of them smoke. Talk about, it should not be genetics, addict to cigarette. But the problem is when you see your parents do something, you tend to follow. Because your parents, you smoke cigarette, you're going to tell your kids to do not smoke. Okay, if you're alcoholics, your kids tend to be alcoholics. So the problem is that many of you who doesn't have medical background may not know this term. It's called inflammation. When you have some infections in your leg, it's called inflammations, pain and swollen. The inflammation is the root cause of our aging process. So if we can slow down the aging process, we have to slow down inflammation, and it starts with fat. 60% of our brains is fat. So we need to start by eating the right kind of fat. And I'm not talking about cholesterol. I'm talking about the bad fat. We need to avoid fried food, everybody knows. Trans fat. And the problem is, for years, cardiologists advise us to use soybean oil and vegetable oil. Actually, there's a component of oil that you have to be aware of. You should take omega-3 supplements. A lot of studies shows that omega-3 can help the brain. And of course, omega-9. The problem is that most Thai doctors, or maybe the whole world doctors, don't understand this arachidonic acid thing. They say red meat is bad. The studies show that fat from red meat can cause cancer. Why? Because it causes inflammation. It can cause stroke. Why? Because it causes inflammation. Why it causes inflammation? Because the animal, us included, human included, can make something called arachidonic acid. So it's not cholesterol in the fat. It's arachidonic acid in the fat. And they try to say this term 1,000 times and people still, oh, don't eat meat because it contains cholesterol. The dangerous fat that causes inflammation, which actually the root cause of heart disease, brain disease, is arachidonic acid. And it's found in large animal fat, beef fat, pork fat, chicken fat, okay, and milk. Okay. We can make arachidonic acid from omega-6 vegetable oil, like soybean oil, as well. So when there's people in Thailand, a group of people who eat vegan food all the time, 90% of them, or almost 100% of them, develop stroke. Wow, they're vegan. How could they develop stroke? Because they put soybean oil in just about everything. Their life is filled with omega-6. And then we talk about cholesterol in the diet that is bad, but actually there's no study proven that diet cholesterol can lead to heart disease. Why? If you eat cholesterol, the body will stop making cholesterol for one. The body doesn't need cholesterol, you feed your body with the cholesterol, and cholesterol is the source for your hormone. Actually, for 10 years now, that nutritionist guideline has no longer said that you need to cut down cholesterol in your diet. So when someone still eat white egg and say, oh, don't eat egg yolk, it's dangerous, actually is outdated. The problem is, if you don't eat egg yolk, you will not have enough vitamins. And vitamins, essential vitamins and minerals, are found in egg yolk, not white egg. White egg has nothing but albumin. So where you're going to get these nutrients if you don't eat egg yolk? Vegetable, fine. But you know, sometimes when they call vegetarian diet, it's not whole plant-based diet. For example, French fry is vegetarian, right? Are you going to eat that? You think you're going to expect any vitamin from it? Popcorns are vegetarians. And I see my patient, I say, oh, please do vegetarian diet, whole plant-based diet. She doesn't understand. This day you have hamburger, vegetarian hamburger, and tastes like meat. They're filled with preservatives, okay, and additive to make it taste good. Don't do that. Eggs is the one factor that can prevent Alzheimer's, because first of all, you need micronutrients and you can find in egg yolk. If you refuse to eat eggs, like some people who are serious vegan, you need to take supplements, especially vitamin B12 and iron. Oh, I used to do a television show, and one time I do television show for these vegan promotions group things. And they say, why don't you eat egg? And she said, because it's from animal. I said, I respect your need, okay? If you don't want to eat any animal product, fine. But do you think that eggs are a living thing? Egg doesn't have soul. And she said, why? Egg is a living thing. Egg is not living things because egg contain only one side of chromosome. Every day, the hen will lay eggs. And these hen don't need to have a husband to lay eggs. You can buy eggs and try to incubate it at high temperature. You're not gonna get a chicken. So they are not a living things. They come from a living things, but they're just one pair of chromosomes. Okay? Because eggs, hens, don't have husband. They don't need to have husband to lay eggs. If you want to, and my friends just have hen because she want to do her own eggs farm. Actually, there will be a I try to add nutritional value to that. And people say, oh, it is noisy every day, it will kind of cock-a-doodle. I said, no, they're not rooster, they are female. No, they don't need husband, they lay eggs, okay, and they don't make any noise every morning. The misunderstandings about cholesterol that in eggs and lead to the bad fat that we call trans fat, like margarine. 40, 50 years ago, the cardiologists say, oh, don't eat butter, it contains cholesterol. Don't eat egg yolk, it contains cholesterol. And then the Crisco company, I should not mention name, but anyway, it's true. They make this fat from omega-6, okay, oil called trans fat. And since then, the incidence of cardiovascular disease and stroke just go up and up and up and up. I never see any cardiologist try to apologize for misled us. And it turns out that blood level of trans fat indicate dementia. At same, 45 years ago, they say don't eat egg yolk, eat vegetable oil like soybean oil. 45 years after, turns out that all these recommendations from American Association of Cardiology. Sorry, my English, I tend to say American Association of Cardiologists, who recommend us to eat soybean oil. I use soybean oil too. And afterward, and I use trans fat too, because I believe in American Association of Cardiology. And then up, the study showed that incidence of cardiovascular disease doesn't go down, but it's going up. So don't believe cardiologists. Go to the basic biochemistry. So when you look at vegetable oils or unsaturated fat, you can have omega-6, which is bad. Like soybean oil, it can switch into arachidonic acid. Soybean oil, so not good. But then you have good oil. One is omega-3 oil and one is omega-9. You can get omega-3 from egg yolk. You can get omega-3 from fish. But if you think that fish nowadays contain too much heavy metals, you can get omega-3 from flax seeds as well. Okay, a lot of seeds contain omega-3. Omega-9 is the easiest. It's called olive oil. And that's my favorite. I had olive oil all the time. Even though I bought food from outside and eat at home, I will pour and drip olive oil into my food. Fish oil, this is something I've been taking every day. When you purchase fish oil, please look at the amount of DHA and EPA. The studies prove that high amount and large amount of EPA, high serum of EPA, indicate longevity, healthy living, longer telomere, and also now even have the pure EPA drugs to treat and prevent cardiovascular disease. DHA itself is a part of your brain and retina, so you need both. So any one of you who doesn't eat fish because you're vegetarian, please eat egg yolk. But if you are vegans, you can get fish oil, which is a phyto fish oil from flax seeds. And now there's some place they have something called phyto omega-3. Please do that if you are vegetarian, like the Indian group, okay? Otherwise, you will not have enough omega-3 to prevent your brain from stroke and Alzheimer's and other diseases. When you buy fish oil, don't be fooled by the amount that it's written, like 1,000 milligrams. You have to look through the details on the size, add DHA and EPA, and see the ratio. Regular fish oil will have only 300 milligrams of fish oil among 1,000. The rest of it is soybean oil or omega-6 oil that we don't want. So you need to buy at least 6 to 10 ratio of fish oil. Okay, look to the size. Don't look only how much of milligram on the per capsule, because some fish oil is not concentrated enough. Okay. Myself, I import the fish oil myself. At the beginning, I say fish oil should not be made in Thailand because Thailand is humid. You can see that you sweat all the time. It's not a good place to make fish oil. Good fish oil have to make from Scandinavian country because the water up there will be clean. Okay. And then one day I found this fish oil imported, so I imported myself. You know why? Because the people who sold to me said, you can taste it. I said, really? You know, fish oil, if it's old, if it's esterified, it tastes like it. Okay, so fish oil, you put it in a capsule, right? You never taste your fish oil. But my fish oil, I just taste it. Tastes like orange because it's fresh. If you taste fish oil in Iceland, it's fresh as well. So I decided to import that fish oil and I call it Suck Me Fish Oil. Became best-selling because when I give a lectures, I don't have fish oil here, but they say, "El, you don't want to believe me? You don't believe me? You can suck my fish oil. Don't try. Don't think. Don't even think. Don't think. I see your face. No. You can suck my fish oil. Who want to suck my fish oil? Raise your hand. Everyone raise my hand. Okay, raise your hand. All right. That story about fish oil. So the fresh fish oil, you should be able to taste it. Okay. It should not taste fishy. But you have another good oil called olive oil. Pour it whatever, keep using it. The question is, people always ask, can olive oil tolerate heat? Fish oil cannot tolerate heat because it has so much double bond, 5 and 6 positions. It cannot tolerate heat. But olive oil can tolerate heat up to 200 Celsius. Why? Because within olive oil it also contains saturated fat. So it can tolerate heat. It's a good oil for the brain, and study has shown more and more that olive oil can prevent heart disease, Alzheimer's, and cancer, all 3 diseases in one. So why not go for olive oil? But the problems about Alzheimer's is it's multifactorial risk factor. There's more than one. You cannot do a one magic pills. Like yesterday, a lot of people asked me, "Oh, why you look so young? What kind of magic pills you taking? This or that and those?" There's no one magic pills. You have to start with lifestyle, and one thing that is a pain, which is exercise. Okay, exercise is so important to prevent all kinds of diseases, including Alzheimer's. So it starts with lifestyle. There's no one magic bullet to make yourself live longer. And when we talk about longevity, there should not be specific organ like, "Oh, I just want you to take care of my skin. I want to be beautiful forever. I don't mind to die young as long as I die pretty." I say that's easy. Okay, that's easy. But the problem is when you have Alzheimer's, you're no longer pretty and you have no idea that you're so ugly. So you better keep your brain, right? You better keep your heart working. So every organs come all together, and all cause of chronic disease is aging. That's why I have anti-aging academy for 18 years. People will laugh at me at the time, but most of my friends now just retire and they come and help me. Okay, so it's scientific. If you look through science, like I try to explain to you, it's always scientific. You just have to apply it into your real life, which is not that difficult, right? Exercise, taking fish oil, olive oil. Okay, stop trans fat, stop soybean oil. Why it's going to be so difficult? When we talk about Alzheimer's, there's so many risk factors. That's why it's difficult to treat. Because if they've been smoking 2 packs of cigarettes a year for 30 years, even though they stop smoking now, the problem is not going to go away like that. It's already damaged, inflammation, everything. So all you can do is prevention, because we look at what is the risk factor and what is the protective factors. We try to add protective factors in. And I found that treatment is so difficult, but prevention is possible. You start by heavy metals. Okay, I try not to cry, but I'm gonna tell you that when Gopal gave me these lectures, I was speechless. My mom has Alzheimer's. So I go through this. I went through this. That's why I never give lectures on Alzheimer's. This is the first time, actually. Okay, why she had Alzheimer's? One thing I know that she's been taking a lot of aluminum. When she was younger, she has a gastritis. She has actually peptic ulcer, gastric ulcer. At the times we talk about 40, 50 years ago, only drugs that we have is antacid gel. It's antacid. It's made from aluminum hydroxide. The doctor asked her to take 30 ml before meals, 30 ml after meal, 3 meals a day, and 30 ml before bedtime, 7 times a day. So she takes 210 ml of aluminum hydroxide every day. Actually, aluminum absorption is only 0.03%, that only 0.03% that remain in our body. Only 0.03%. But you will take a gallon a month, a year, that's 0.03% could mean something, right? So I believe she had Alzheimer's from aluminum. You know why? Because aluminum can cause 3B diseases. You never heard of it in medical textbook? B, and I know it because that's my mother. The first B is bone. You will have weak bone, osteoporosis. My mom has that. She broke her hips. You will have weak brain, Alzheimer's, and you will have weak blood. She has pancytopenia. So I know that she has Alzheimer's, pancytopenia, broken bone from aluminum. When we were young, we have gallons of alum laying down. We play on it. The second thing that you don't pay attention much is glucose. People who have diabetes tend to have worse cognitive function. Okay, so cut down sugar a little bit. If you heard someone in Thailand say sugar is toxin, I'm proud to say that create that statement. I want people to remember sugar is toxin. If you go to Heat Congress and they say sugar is, the entire room will say toxin. Thank you, you're ready. But sometimes the sweetness, you don't see sugar, but it's part of all processed food. And you know what? Sometimes these are vegetarian. Monosodium glutamate is vegetarian. So this contains sugar and salt. When I went to Starbucks, again, I should not mention name, and they asked me, doctors, why you drink coffee? You do want breakfast? I say, you are not selling me any breakfast. What you're doing right now, I see, is toxins. The entire day, they cannot sell anything again. One thing funny about brain that most people don't know is there's a connection between your gut and brain. Many knows that when you are so excited, some people got diarrhea, some people got like butterfly in the stomach. That happened because we have vagus nerve stimulations coming from your guts and brain. And surprisingly, when your gut is full with toxins, your brain will go too. So you want to preserve your brain health, take care of your gut. Neurologists never know about this. I never see any neurologist prescribe probiotics, gut cleansing for the patients. You have to come to Kamalaya. Okay, there's a lot of gut-brain connections, including autism, memory loss, anxiety, and depression. I believe that, you know why? Because when I treat guts of my patients, many times their brain functions improve, and always one thing that improves, the skin inflammation is improving. I have patients who have exfoliative dermatitis for 16 years, since he was 2 years old until he's 18. The doctor pays steroid entire body until he have a cataract. I treat his gut for 6 months. It's not go away because he's have a 16 year, but his mother says it's so much improved. Otherwise, when he walk around, his skin will peel off. So imagine wherever you walk, his mother have to do a vacuum cleaning. And he didn't have a girlfriend back then, because which you're gonna want to be a girlfriend to the guy who just has skin peel off all the time, a lot of dandruff. Now he has a girlfriend, and his mom just said, "Oh, I just noticed he have eyebrow. He never had one before." Okay, treat gut and your skin will be beautiful, and your brain as well. Funny thing about gut, most people don't know that inside you may contain fungus, and the study shows sometimes fungus infected your brain. So here in my clinic, we're going to have the anti-fungus like nystatin. We can test if they have a gut dysbiosis. We can treat, okay? And even also, some people have antibodies called mycotoxin against fungus. You never test, you never know, okay? And here, if you test it, maybe become the role of hyperbaric. Hyperbaric can kill infections where the blood supplies cannot get into. There's a few places. One is the brain and spinal cord, and the second place is your eye. Your eyes, if it's infected, say goodbye, because the eye cannot have blood supply. It can. Once it infects, it has the blood supply into it, and you will get blind. So when you have eyes infection, brain infections, it's good things to have oxygens, hyperoxygen, to kill those infections, because the antibodies will not get in. So you want to have a healthy gut and get beautiful skin. First, you need to keep your probiotics alive. Stop using antiseptics everywhere. During the COVID time, people start using Dettol antiseptics. I say, what's the point? Regular soap can kill COVID. You don't need antiseptic to kill COVID. What you kill is your own bacteria in your skin. You need digestive enzymes. You need to eat more prebiotic like vegetables. You may try some probiotic foods like natto, or taking probiotic supplements, okay? The good things about brain, the bad things about brain is it requires nutrients and you don't know. Nowadays, medical practice say supplements are bad. The problem, the truth is, I have patients who live longer than anybody else, and I gave them supplements. We need supplements because we cannot get all of this from our food. Some of them can IV injection like curcumin, resveratrol as well, or glutathione. We need antioxidants to prevent oxidative stress. B is for brain. We have 8 Bs though. You call vitamin B to 12, but actually we have only 8 vitamin B, 8 kinds. 7 of them found in grains, vegetables, okay, the soil-grown vegetables and seeds like pumpkin seeds, pumpkins, corn, something. The last one has to come from animal because it's made from gut microbiome, it's made from probiotics. So if you are vegan, you will not have vitamin B12. So that's why I asked the vegan to convert into vegetarian. So at least you have egg yolk. And someone say, oh, but what about cholesterol? I said, oh, please, I have to give you a lecture again that cholesterol in egg yolk has nothing to do with heart disease. So are you vegan or vegetarian? Vegetarian, thank you so much. Otherwise, you will need B12, okay, and flax seeds oil, you need omega-3. All the vegetarian, you need more vitamin B12 and omega-3 because you're not going to get enough from your food if you have vegetarians or vegan. What about coffee? I'm a bad guy. I drank coffee since I was 9 years old because I didn't know. Well, that's why and then I tried to do, oh, is this bad for my brain? Turns out that's why I'm very smart, okay? I believe I'm smart. You think I'm smart? I don't know how you're gonna measure smart. At the beginning, when I was young, because I pretty much #1 in internal medicine board exam, nephrology board exam, I have PhD in cell biology, also #1 in Florida. But then nowadays, I realize that actually indication of stupidity is #1 thing. Because people who get to #1, they get it by, you know what? Stop thinking, memorizing, and be obedient. Correct. So actually, I'm the most stupid person in school because I'm #1. I have to think by myself. I have to fight against authority, which I've been doing for 20 years. Anyway, coffee allowed me to do that. Okay, it stimulates brain, but it's a two sides of coffee. If you drink coffee and then you have hypertension, you have palpitation, don't. Okay, you may want to switch to green tea. Okay, so but if you drink coffee and you feel okay, you can sleep, you can relax, that's still okay. So there's two sides of coffee, but you can choose to have caffeine from green tea instead. Okay, for someone who doesn't like coffee. But the study of coffee is pretty much positive for the brain, but probably not for the heart. I rather support the natural herbal therapy for dementia because nowadays we have certain drugs. First, it's too expensive. And it just, what it does, it just only increase acetylcholine in the brain. And actually, you can increase acetylcholine by eat egg yolk because it contains choline that can switch into acetylcholine. And pretty much everything here reduce inflammation is symptomatic. And I have tried it all, and I see that, okay, they're not going to be Einstein, but it prolongs the life of Alzheimer, including my mother. Yesterday, I talked to you, so I just add these slides in because people are so interested about longevities, telomere, and stem cells. The truth is, when we are older, our cells will have shorter telomere. But don't believe if someone tries to sell you drugs. Oh, take this, it will enhance telomere and you will live longer. Telomere is a sign of aging. Reverse it may not help you reverse aging. Why? When the cell is dividing and then something wrong happens, the cell will tell itself, stop dividing, because if you go on, you will have cancer. If you do the blood test for telomere length, you know what kind of disease, then you're going to have a longest telomere length, longest. It's called leukemia. So telomere is a sign of aging. Reverse it may not help, but prevent it, that could help. Okay, so how we gonna increase telomere length in the safe way? It's called senolytic. What is senolytic? Imagine that the cells that do not do anything, sitting there and not working, take place from the younger cell, and younger cell cannot work because the old place just replace them. We call it the zombie cell. Okay, think about Kamalaya. I love your staff here. They always come with a smile because you never give them free Botox. Okay. They always have smile. They help each other. I can notice that all of them love Kamalaya. That means you are a good manager, that's why they love Kamalaya. They want this place to be better. But you have to hire someone to sit in, not working, except just go to you and say, oh, I'm good. And then come and treat this group of people, of staff badly. They're not going to be happy. They're going to sitting there and do nothing. That's zombie. We see that in parliament, right? We see that in the government. A lot of people earn money every day and doing nothing. Imagine if we get rid of these old politicians, the world will move forward. And that's what we do in mice. There's 2 studies in mice that show these mice have a genetic defect. They feed this mice, and the old mice, one day feed them to kill the zombie cell, it became young again. So anti-aging medicine is not a dream anymore. Imagine I have a zombie cells in my brain, zombie cell in my body, and now I'm gonna kill them so I can be young again. The problem is, we can have to wait until someone develops drugs. Right now, we don't have to wait because you know what? We go for supplements. And turns out the supplement that can kill the old cell, quercetin, fisetin. And some of you who hate supplement, you don't have money to buy supplements, super poor, look at you. You spend all money on your stem cells. Never mind. You can eat cucumber. Don't tell me you don't have money to buy cucumber. Okay, cucumber contains fisetin. So we can be young again by eating cucumber, okay? Not try. But to prevent it, it comes back to the good lifestyle. Okay. People always ask me about stem cells, okay, which I have a workshop, by the way, at HEAT in August. How to gonna improve stem cell? Like some people use mesenchymal stromal cells. I believe in it because I've been using it for how many years? I don't know. 13 years, 14 years. And I'm just like song from the Beatles. I'm gonna celebrate my Beatles birthday this year. You know what is the song? When I'm 64, and I feel good. Okay, so why not? My friends already retired, and I can see once they retire, their brain function just drop. Okay, one thing that found that if you can transfer the blood from the young mice to the old mice will become young again. We call young blood plasma transfusion. The study in Texas, they don't allow it now. They put the dementia patients and they do a matching. For example, you have a son and you don't want to have dementia, or you have dementia, you have a son, same blood group. Ask your son to give you blood every 3 to 4 months. Okay? It can happen that some people do that. Okay? Actually, they don't use their son, they buy. Okay, they take care of this guy. Your blood is valuable to me, it's matching, so give me blood every 3 or 4 months to maintain my brain. So it's difficult for me. At the beginning, I didn't add this slide in because this one is televised and I don't want people to misunderstanding and do something crazy. But there's people do. That's a real world thing, okay? Giving blood from the young. Because I found when you do the blood transfusion from the young, the patients who receive young blood do better than the old blood. I receive young blood every years, okay, but not from anybody else, but just newborn baby. There's a technique about it. The last things I'm going to talk about is about hormone. The problem is when you have dementia and you go to see a neurologist in Thailand, the sad thing is none of them check for thyroid. And then somehow they come around in circle because I have more patients than anybody else. I say, why don't you check thyroid? Because I think you have hypothyroid. And turns out they have hypothyroid. How could they feel about that neurologist that never check their thyroid function? So when you have dementia or you don't have dementia, yet you think you have dementia, I told you before, you have to check your CT scan, you don't have brain tumors, and also thyroid function. The controversy one is about hormone and dementia. Men has more Parkinson, men has more stroke. But dementia is a disease of ladies. Why? Because the ladies, God loved women. God gave women a youthful elixir called estrogen. But women ignore God. So when it's time that they reach the stage of menopause, they say, I don't need estrogen. Bye-bye. Estrogen is dangerous for me. Bye-bye. And that's the problem. Because the estrogen come down and dementia start. Men, on the other hand, can switch the testosterone into estrogen. Okay, and that's why women, maybe one reason that why women has more dementia than men, because the loss of estrogen. However, if men has dementia or Alzheimer, he die faster than women. It means men still have estrogen when they reach certain age of andropause. But if they have dementia, that means they don't have estrogen, and now they die faster than women. And turns out that women who have more estrogen, like have more kids, 5 kids, 10 kids, have a chance to develop dementia less than women who doesn't have children. Okay, women in this room, let's go out there and make a baby. I don't care who's gonna raise it, give it to Gopal. Because estrogen is for prevention. I told you yesterday that it's about preventive effect, not treatment. Once the ladies develop dementia, it's difficult to treat and not possible to treat and should not be treated with estrogen. My mom, actually, when she reached menopause, she used estrogen, but at the time her estrogen is very bad. It's called Primalin. It's made from horse urine. Yeah, you got it right. And turns out it's dangerous. Nowadays, the estrogen nowadays is topical. You paint on the skin. And the studies only show the positive thing from topical estrogen. No more side effects if you use it wisely. So the ladies in this room, if you under 60 years old, you're 50 to 60 years old, you should use estrogen. After that, if you don't have any heart disease, you can still use estrogen. Okay. Another thing is that if you have good night's sleep, the chance you're gonna get Alzheimer is less. When we reach certain age, we have trouble sleeping, and we should have, because we don't have this one called melatonin. Melatonin is the first anti-aging pills or anti-aging hormone that they use. I used melatonin since I was 30 years old because I've been working so hard, I barely sleep. At the time, I start melatonin and I've been taking it ever since 1 milligram every day for 34 years. Long before I knew that it helped my brain to stay young. It's an antioxidant for the brain. It makes me sleep, and also it has effect, at least in animals. I'm happy to be a lab rat as long as they're young. And it shows benefit in cognitive impairment. So any of you who has trouble sleeping, please do take melatonin low dose. Now, last but not least, brain needs sanctuary. It's called mindfulness. Besides aluminum, I believe my mom is an emotional lady, and giving her Primalin make her like a mad dog, even worse. And she never have a mindfulness. Her mind full with something else, okay? And a lot of studies show that mindfulness alone can increase telomere length. Nobel Prize Award by Elizabeth Blackburn. So this is a place that's good for you to try mindfulness. It doesn't have to be you don't have to chant, but you can chant. You don't have to be Buddhist, you can be Christian, you can be anything, you can be Hindu. Okay, it's about you. I've been doing mindfulness every morning, sitting alone and listen to the music and let my mind wandering around. And sometimes I can get an idea about things and organize my idea just by doing mindfulness. Another thing that it shows that people who have good brain function need to use and interact with other people. So when you come to Kamalaya, I'm surprised many of you come here alone. But this is a good time for you to say hi to other people. Do you know people anywhere?
Everyone.
Oh, you're not gonna have dementia. Okay, that's perfect. Okay, so talk to people. Social interaction is so important to prevent dementia. This is Thailand. It's a land of smile. So do smile. Actually, I want to show pictures of a bench. A bench. You know, I put sofa at my event and hope that someone will sit. But this day, when people sit on the sofa, they start playing on cell phone and they don't talk to each other. Sit on the bench without playing on cell phone and smile. You never know who's gonna sit next to you. It could be for Mr. Forrest Gump, tell you a story, and that helps. You know, brain is about time. We live under a borrowed time. Time move on, but then one day our time will be gone. Time is the best gift that you can give to someone. When my friends come to my party, when my friends come to my dinner, after I pay for the dinner, their dinners, I thank them. They don't have to bring me any gift because they already bring me the best gift, their time. Imagine that. You need to spend time with someone and don't forget to spend time for yourself. I told you before, the most regret things that I have is I didn't spend enough time for my mother. I tried to make things for myself. And then by the time I know it, she already broke her hips and she had Alzheimer's. The last 10 years of her life, before she passed away, I tried to spend more time with her. But then, actually, her brain is not there. Her time is not with me. But I know that she remembers me because anytime she sees me, she smiles. The person, her children, she always remembers her children. She doesn't remember the names, but she smiles and claps her hand. There's someone who she loved the most. I want you to think about today, tomorrow, how you're going to spend your time here and spend your time for the rest of your life. So now on, that's why I told him that every day of my life, I have to be happy. I try myself that why I spend time on earth, because I want to make a difference. I still have a dream, I still have a hope. I know I'm gonna reach my dream because it's too far, but I will keep going on because I know that my time on earth is limited. I know someone when the time on earth, when the time in this life is running out, they try, because all of this time in their life, they try to spend time to making money. They forgot that health is wealth. Of course, they live at Wall Street, then they will come to Kamalaya. They never been here. They're busy making money. And when the time in this world is running out, they try to spend that money to extend the time of their life. And just wonder why you need more time in your life. when you don't have a life at all. Know about life. That's make your time worthwhile. So I thank Gopal for inviting me here to spend time. Time to walk, okay, in the sun, walk in nature. Time to eat vegetarians. Time to know all of you. Time to speak here. And I know that this today, my time is worthwhile. And I'm happy to spend another time, more time here. And of course, I have to thank all of you because you're sharing your precious time with me, right? This is your precious time and you share it with me. So we're sharing each other the best gift. Okay? Try to spend time for yourself, for your loved one. Try to spend time to make a difference. That's what we need. That's what the world needs. So thank you so much for the best gift you give me is the time. ขอบคุณมากครับ
I think adding on, I must say that, as I said at the beginning, that we get a lot of experts like Dr. Patana. And when we do these talks, it's very reassuring for Kamalaya as a concept that from last 20 years, we are so proud to be doing all of that, fighting against the wave, going towards the alternative healing that Kamalaya provides. And we have an exceptional team. And recently, when we did our cognitive house, the idea was not to bring more machines, but to bring awareness to people that brain training is highly important, right amount of supplement is highly important, right diagnostic is highly important. And that's the aim that we are working towards with these little additions. So please enjoy your time with Kamalaya, make the most of everything. Dr. Patana mentioned the chanting. We do it every day here, 7 o'clock, every day, free of charge. Every day at 8:45, we begin with a mantra, the yoga class, the movement. Yesterday, I think some of you were at the aqua aerobics and I think people who were there, they laughed for that 45 minutes because it was funny. They couldn't move and you're floating and you're trying. So it was more than an exercise, a brain exercise, because people, and one lady, she was like, oh my God, I think I've never laughed so much in my life that I laughed during an aqua aerobics. We do something called salsa dance here. And the idea is not to make people dance, but in that class also when people say, oh, I can't move, how inflexible I am, and they laugh and you laugh. And that's, through various methods we try and bring these things to life. So again, thank you very much, Dr. Patana. And I will open up for more questions. If somebody has any questions, any questions, please feel free.
I have two questions. One is that can a woman be on estrogen therapy indefinitely? And secondly, from what I understand from your talk, cholesterol is not
as bad as we
Yes.
think.
So does that mean that if someone has high levels of cholesterol, that's actually bad, or it doesn't matter?
Okay, first thing first, start with the questions on. She asked me if women can on estrogen forever. Forever is the long term. So far, they start saying that 10 years will be safe, especially its transdermal form. No side effect come from transdermal for at least 10 years. And that 10 years is a long time ago now. The study now come to about 15 years. So I believe that as long as you check there's no side effects, it could be forever. And especially if you want to be pretty forever, it's so important. Estrogen is definitely help with the bone osteoporosis, definitely. With the skin, definitely. with the vasomotor symptom, hot flush, definitely. What is uncertain is the prevention of heart disease and Alzheimer's, because it's uncertain because there's so many factors on it. Humans are not animal tests. We cannot control it. So each woman eat differently. So, and we need multiple approach. So the answer is, I think so. Okay, I think if you use the right kind of hormone, you can use for life. Okay, we can see the Miss Universe 100 years old Universe pageant. Although I may have to enter the oldest Mr. Universe pageant soon too. Okay. The second question is cholesterol is bad. We have to separate two things. One is cholesterol in your diet, and one is cholesterol in your blood. For 40 years, the doctors have been told that the cholesterol in your blood is high because you eat cholesterol, and that's not true. Blood cholesterol doesn't come from food cholesterol or dietary cholesterol, because actually 90% of cholesterol in your body is made from the liver. So when you have liver failure, you can have low blood cholesterol. So actually high blood cholesterol, if choose wisely, it doesn't cause high blood cholesterol. High blood cholesterol comes from food that's no cholesterol. For example, trans fat. Okay, the study show that actually trans fat, artificial butter that can force the liver to make more cholesterol. So food that contain high cholesterol like seafood, egg yolk can be eaten without serious concern. So that dietary cholesterol. Now, in terms of blood level of cholesterol, definitely show that if it's too high, it's not good. Anyway, one thing that I have to fight against cardiologists, because right now they try to force people to have super low blood cholesterol by taking medication called statins. The problem is, the study shows that in women, if your blood cholesterol is too low, you will die from cerebral hemorrhage. Okay, so actually too low is not good, too high is not good. Okay, so it should be in the middle range. So I think that whether you need to care about your blood cholesterol, there's so many factors before you taking medication. For example, do you have diabetes? Do you smoke cigarettes? Do you have previous heart disease or previous stroke? I don't agree that nowadays when people only 30 years old and start taking cholesterol lowering agent, it's like it's gonna be a longevity drugs, because in my experience, the side effect will overcome the benefit. So we need to find the people who need to take cholesterol lowering drugs. And the second thing is, funny thing is, we have many kinds of cholesterol lowering drugs, but only two can prevent heart disease. It's called atorvastatin and rosuvastatin, because these two are the only cholesterol lowering drug that can prevent inflammation, the root cause of heart disease, and that's not cholesterol. It's called inflammation. So why don't you start by taking fish oil? You can check your fish oil level, you can check inflammation level, you can take olive oil and see. If you actually have heart attack or stroke, yes, maybe it's a time for you to start taking statin. But to believe that taking statin now will prevent heart disease for the rest of your life, that I have to say the foolishness of American Heart Association. Because in my life, I've seen a lot of patients who develop complications of statins, taking simvastatin, which never have any study proof to prevent heart disease, for 10 years and receive cardiac balloon angioplasty 5 times. 5 times in 10 years, can the doctor never know that this is a failure of medical treatment? And he came to me, and the next 5 years never have heart attack ever since. So we need a multifactorial approach, not just one bullet pill. Statin or not, fish oil or not, we need multifactorial factors. You have to be the best doctor for yourself. We have to start with lifestyle, food, exercise, stress, everything come all together. Okay, but after you have a perfect lifestyle, maybe stem cells, maybe something else can help. But start with perfect, the best you can do, lifestyle. Okay.
Gabriela?
Yes. That answered the question, right?
Yes.
Okay. Okay, I add something extra for someone who have high blood cholesterol and don't want to take statin or take statin. Please do take coenzyme Q10. There's a lot of study proof that it can prevent heart disease. Not a big one, but it helps. Okay. Coenzyme Q10.
So would it be the same to take ubiquinol?
CoQ10 has 2 forms, ubiquinol and ubiquinone. Yes, you can take ubiquinol, 100 milligrams a day. But the studies only done with ubiquinone, but I believe ubiquinol can switch to ubiquinone. Okay. Okay, but I cannot say ubiquinol because there's no study much about it compared to ubiquinone. Because you are here, I try to talk academic, which usually I'm more freely.
I just hope my question won't be too personal and it will be useful for other ladies here. After having ovarian cancers, the doctors say that I cannot have estrogen more than 5 years because it can cause breast cancer. What would be your opinion about that?
Okay. Good news is a new study just coming out this year that if you use a small amount transdermal estrogen, it will not cause breast cancer. It might even prevent it. Okay. I just hope. The problem is if you have a marker, like tumor markers that you can check if the cancer coming back, that will be helpful. Like a guy who have prostate cancer, I can check PSA level when they give them testosterone. If you have ovarian cancer, sometimes you can check for CA125, but the breast cancer, sometimes there's no marker. But usually in my experience, I give hormone, small amount, let's say 15 days a month to patients who have ovarian cancer, breast cancer, and in remission, by the way. It has to be 3 years after the cancer is been treated and done, and there's no problem. She can have life again. And actually, I would explain to her why she come to me, because after the doctors remove her ovaries, for 3 years, she did not have a life. And she said, the time, for 3 years, I have a time in my life that I cannot do anything. I feel angry, I feel depressed, I feel hot flush, my skin is dry, my white vagina is dry, I cannot have sex. My husband gonna divorce me. Doctor, give me estrogen. I don't mind to have cancer once again, as long as I have a life while living without a life. Please, sometimes gynecologists don't understand. Okay, their job is to remove your uterus and ovary. Okay, and that's it. That's not the point. I think I answered your question. You can use it more than 5 years if you follow up, but use it a transdermal form, please. Okay.
If I understood correctly, that patient you prescribe 15, half of the months, and then again.
Yeah, I let them have a menopausal episode for 15 days or maybe 10 days a month to play it safe. Anyway, when someone have a cancer of female organs like breast and ovary, it doesn't come from natural estrogen. It comes from something we call xenoestrogen. And I would advise them to stop that. To start by milk and food processed, put in the foam, beer. Okay, search for XENO, estrogen. plenty of them these days. Insecticide, pesticides, food in the plastic, and then you microwave it, food in the foam box, and then you microwave it and you eat it. Those act like estrogen and cause cancer. It's called toxins. And that's a problem that they found. And also cow's milk. Cow milk contains estrogen and it's not our human milk. It's different. Okay, so things are quite unnatural these days. And always when someone have cancer come to me, I will check for vitamin D3 level. 99% are low, so I recommend you take vitamin D3, okay, as well.
Thank you so much.
And broccoli.
Thank you. Wonderful.
Thank you.
Thank you. Two questions. The first one, if you had to choose a milk,
If you had to choose a milk, which milk?
which one would you choose? And then the second,
Choose what?
Milk.
any type of
If
milk.
you were to choose
Like
any
not
milk,
cow milk,
yes, which one would you choose?
Okay,
would you go oat milk,
okay, okay.
soy milk? So that's the first question is around milk, because most people want some milk from time to time. The second question is, any thoughts on cannabis oils or anything like that? You don't mention any use of cannabis, long-term, detrimental or positive. I was just curious because there's some market
Okay.
stuff on that.
First question is about milk. Second question is about cannabis. Okay. First question is easy. If you want to use milk, use the one that low in omega-6. For example, oat milk, pistachio milk, almond milk, and milk that high in omega-6, like cow's milk and soybean milk, you should avoid. That's easy. Anyway, cow's milk, when they talk about cow's milk, you go to certain country that they have to use cow milk, it will be bad, like butter. Okay, actually butter contains less omega-6. Okay, butter is almost 100% saturated fat. You can use butter a small amount, okay? And milk in some country, like Australia. Anyone come from Australia? Okay. Okay. You may know more than I do. But in Thailand and in America, milk tastes like fatty, like God. But in Australia, milk is light because cows eating good food. When you cows eat omega-9, milk contains omega-9, but in Thailand, cows eat synthetic food, so milk tastes like. So in Thailand, when I drink flat white, I ask for oat milk. In Australia, I go for cow's milk because it tastes much better. Okay, so it depends on what kind of food cows eat. The next question, cannabis. Unfortunately, we don't have enough studies on that. We have small studies, tend to be positive here and there, which is not reliable. So I cannot say. The reason we cannot have studies on that, because like in Thailand, if you want to do a cannabis studies, you have to ask permission and the ethic will say, oh, it's dangerous, don't use it because it's marijuana. So the study never moved forward about cannabis at all because the ethic company on the conception of the people will take 10 years from now, I guess. And it takes a lot of money. So I cannot say. But anyway, the way I treat my patients, I look at them as a one person. I don't follow guideline because my patient would tell that they like it. If they're getting better, sometimes they just help them sleep. Sometimes it helps them calm down. I have the cannabis oil that help me have someone sleep. So if they can sleep, that's good. Okay, so see if you like it or you don't like it. That should be the answer. Yes.
If you tested high for heavy metals tomorrow, what would you do to most effectively detox it from your system?
Okay, still be EDTA chelation that can take most of the heavy metals. However,
DKA, like vitamin?
It stands for ethylene diamine tetraacetic acid. E like Eddie, D like Doris, T like Thailand, and A like Anna. Okay. Okay, so Eddie, Doris, Thailand, Anna. Okay, you can do IV form. In my clinic, we have oral form, which is weaker, but IV form is shown that you can remove heavy metals briefly, but except mercury. Mercury, you need to use another kind of chelating agent called DMSA. All these are not natural, are chemicals, so it will have side effects. But it's not serious if you use it in the right way, okay? You cannot go and buy ETA from drugstore and start taking it. It's dangerous, okay? Don't. Go under the professional hands is rather safe.
How many IV sessions?
Unfortunately, could be 50 times. So 50, yeah, but I don't want you to do it all at once. Certain clinic right now, they try to make money by selling you 10 courses of ETA. Don't. I say that it's gonna stay with you. So just do it 6 times a year, okay? Do it at your own time. Don't be too serious about it. You don't have disease yet, but they just check that you have lead in your blood. So you're gonna leave it, okay? But then again, we need to remove the cause. You need to ask yourself why you still have lead. Because right now, oil doesn't contain lead. But some people live in an old house, pipelines still contain lead. And some, the highest lead blood level I ever seen, I asked him why you have such a high lead level. And he say he's a gun shooter. And in Thailand, gun shooter never wear protective mask. No protective glove. He's shooting 1,000 bullets, having fun with it, and going have hamburger, never wash his hand. His lead level is like 200. So we have to ask, why do you have heavy metals? In Thailand, when you eat rice, I'm bad again, you have arsenic and aluminum, guarantee.
Can we take a last question?
Okay.
How about yogurt and cheese? Do you make difference between the products from
Okay,
cows?
yogurt and cheese.
And my second question is, do you believe in intermittent fasting?
Okay, easy question. The first one is about yogurt and cheese. The second one is about intermittent fasting. Okay, yogurt and cheese come from milk, but there's a good things about yogurt and cheese is called microbiomes. So first of all, cheese has to be stinky. Okay, not just like has to be blue cheese, has to be feta cheese, not delicious cheese like cheesecake. Okay, that's bad. So, okay, on this first, okay. Oh, you can eat cheese and then you start eating cheesecake. Next time I know, oh God, you have a heart disease. Okay. Feta cheese, okay, or stinky cheese. You know what it is, okay? Okay, the stinkier, the stinkier, the better. More bacteria. Okay, and yogurt should be non-sweetened. So, and should not contain sugar. Okay. Okay, that's fine.
And is it better to have like sheep's yogurt according to you? Sheep's yogurt or
Sheep or cow yogurt, which one would you recommend? Without sugar, for example.
Which one?
Like, there's no added sugar, but would you recommend cows yogurt? Would you prefer sheep, goat? Which one?
Difficult. Okay. The structures of milk from the cow is the worst one. Why? Because it's artificial. Cow these days they eat bad food, put it this way. But the goat and buffalo milk, okay, they still eat kind of healthy food. I mean, I cannot know that productions, whether these cows eat grass or eat synthetic food, so I cannot answer the questions. Okay. I have to go for the source, so cannot say. Okay. Then the second question about intermittent fasting, do you believe in it? Yes, that's it. I do it almost every day. Okay, but intermittent fasting helps you to reduce the amount of your food, the food that you eat. Okay, but it doesn't work if some, I'm bad again, monk in Thailand, monks, they don't eat after lunch. But they they should be intermittent fasting, but they eat the wrong kind of things. Like 1 meal of them equal to 10 meals of some of us. They start with one thing, second thing, and they eat like 10 dishes. And that's not intermittent fasting, that's overeating. And also the monk, any one of you who like to do some charity giving offering for the monk, please don't give monk soft drink, because after lunch he cannot eat food and he go for soft drink. That's really, really bad. Okay, you're not gonna get a place in heaven by giving monk soft drink, but that's true. Okay.
One more question.
Okay, I'm still be around. Okay, in case someone wants to leave, no problem.
What are the healthiest sources of protein?
Okay, healthiest source of protein is two things: organic, whole plant based. Okay, when I say whole plant based, I'm not talking about protein powders made from plants. Okay, organic, whole plant based. Tofu is fine. Mushroom is excellent. So that could be the best source of protein. However, sometimes it's not enough. That's why I ask all the vegetarian people, from vegan people, to switch into vegetarians. You still need eggs. Fish could be a good source of protein if you know the source. And then the new story, the lectures will be at HEAT in August. It's called microplastic. Okay, all the plastic you throw away in the sea has been decayed, rotten, and eaten by ocean fish. When you eat fish, you get plastic. By the way, Dr. Patana, why you drink this Icelandic water? First of all, I'm the brand ambassador in Thailand. Imagine that you are Icelandic model when you are 60 years old, 63 years old. That's wonderful. And secondly, before I represent this Icelandic water, I go to Iceland, I check for the microplastic. These bottles contain no leakage of microplastic. Otherwise, you cannot get Dr. Patana to represent you. Okay, so not every, the bad plastic is the one that, is like a bubbly one and all that. The plastic bag, and some people throw away in the ocean. Okay, Indian actually went to the Mumbai, it's like, oh my God. And the fish will eat it. So fish is no longer safe food. A lot of mercury, a lot of plastic. Organic eggs, organic vegetables, whole plant-based diet, okay? Not plant-based hamburger, okay?
Sorry, you say tofu is okay, but soybean milk is not.
Tofu is a protein of soybean milk, but soybean milk contains fat. So soybean oil is the worst. Soybean milk, if you do it fresh, maybe, but you have a little bit of omega-6. But then tofu is just protein without omega-6. Okay?
All right. Everybody, thank you again.
Thank you so much. I've been around. Okay. He said you don't talk to me, but you can talk to me anytime. Okay, no problem. Thank you so much.